Prevention of sexual violence against medical professionals. A. The Sexual Harassment of Women at Workplace Prevention, Prohibition and Redressal Act 2013 applies to hospitals and nursing homes, including private healthcare providers. In terms of the provisions of the Act, an internal complaints committee must be constituted in all hospitals and nursing homes. B. The duties of an employer listed under Section 19 of the Sexual Harassment of Women at Workplace Act 2013, which includes organizing sensitization programs and providing a safe working space, must be discharged. And C. Ensuring for every medical institution a helpline number for medical professionals, which is open 24/7, and emergency distress facilities. It is clarified that the phrase medical professionals used in this judgment encompasses every medical professional, including doctors, medical students who are undergoing their compulsory rotating medical internship as a part of the MBBS course, resident doctors and senior resident doctors, and nurses, including those who are nursing interns. The phrases medical establishments, hospital, medical institutions are interchangeably used. The NTF shall be at liberty to make recommendation on all aspects of the action plan highlighted above and any other aspects which the members seek to cover. They are at liberty to make additional suggestions where appropriate. The NTF shall also suggest appropriate timelines by which the recommendations could be implemented based on the existing facilities in hospitals. The NTF is required to consult all stakeholders. Bearing in mind the gravity and urgency of the situation, we have included the heads of the National Medical Commission and the National Board of Examinations as ex officio members of the NTF. Bearing in mind the national concerns which have been raised over the issue and the high priority which must be given to the creation of safe working conditions in healthcare institutions, we request the Cabinet Secretary to the Union Government to associate with the work of the NTF. The Home Secretary of the Union Government has also been made a member of the NTF in order to facilitate proper coordination with the state governments. The Secretary to the Ministry of Health and Family Welfare of the Government of India will be the Member Secretary of the NTF. The Ministry of Health and Family Welfare will provide all logistical support, including making arrangements for travel, stay, and secretarial assistance, and bear the expenses of the members of the NTF. The NTF is requested to submit an interim report within 3 weeks and the final report within 2 months from the date of this order. All state governments and union territory governments, through their secretaries in the Ministries of Health and Family Welfare, and the central government, through the Secretary Union Ministry of Health and Family Welfare, must collate information from all hospitals run by the state and by the central government, respectively, on the following aspects. A. How many security personnel are employed at each hospital and each department? B. Whether there is a baggage and person screening mechanism in place at the entrance of the medical establishment. C. The total number of resting/duty rooms in the hospital and specific details of the number in each department. D. The facilities provided in the resting/duty rooms. E. Information on whether all areas of the hospital are accessible to the general public, and if so, with or without any security restrictions. F. Whether there are CCTV cameras in the hospital. If there are, how many and in which locations? G. Whether the institution provides medical professionals training to appropriately handle the grief of patients. If so, the details of the training must be provided. H. Whether social workers who specialize in handling grief of families of the patients are employed at the hospital. If so, then total number of social workers must be provided. I. Whether there are police outposts within the premises of the hospital or the medical college hospital campus. J. Whether an internal complaints committee in terms of the Sexual Harassment of Women at Workplace Act 2013 has been constituted. And K. Whether the employer of the establishment has discharged the duties prescribed by Section 19 of the Act of 2013. If so, the details of it. The data submitted shall be tabulated and filed with an affidavit by the Union Government within 1 month from this order. The Central Bureau of Investigation shall submit a status report to this court by, we'll say 22nd and not 23rd, by 22nd August 2024 on the progress in the investigation of the crime at RG Kar Medical College Hospital. The State of West Bengal shall also file a status report by 22 August 2024 on the progress of the investigation on the acts of vandalism which took place at the hospital in the aftermath of the incident. The matter will now be listed on 22 August 2020.
Not only one request. What is shared by the state of West Bengal with your lordships be given to CBI. We also need have it. They cannot have any objection.
One second, I can just say, what that is.
Lord, what is shared by
My lord, can I just add one thing, my lord?
only what is shared?
Principal of the college, is he now under suspension? Is he on long leave? What is that?
He's on leave. He's on leave. High Court order is Millard's operative. He's on leave. He's on leave. There's an SIT constituted also for all kinds of things. My lord, can I?
Lords, I would.
Anywhere, right?
No. But can I add one
That's
thing?
why I said,
I
whatever
would,
your lordship says, we'll
repeat my
abide by it. That's
request.
not enough.
Whatever is shared,
My-
your lordships, Lord, the CBI must be
Yeah.
given.
No, we will file an affidavit.
But you have shared something with the
One
court,
second.
you can't have any objection.
At not this point, Mullahs. In fact, what
No,
is
I am
happening-
on that point
What
first.
happens is, Mullahs, this goes to them, then the social media takes action. It'll
No, there-
exacerbate the
CBI
situation. This is only to inform your lordships, Mullahs, that what's in the social media is not correct, and what's happening is just contrary to
why
what the
can't
record is.
you share with
For
CBI?
example, they say it's a suicide. It is not a suicide. We never said.
Hinted,
We will, but Mr. Sibal, there was undoubtedly an unexplained delay.
I am not on medical.
yes, Lord.
I am not on
What
that.
is to hide from CBI?
Mullahs, one
This-
second.
This shows we are
One
not
second,
getting
one,
cooperation.
I am not on that, Mullahs, as I said, whatever needs to be done must be done. People must be convicted. There is no issue on that. It's just that I don't want, Mullahs, another kind of tirade in the social media.
No, it
Mullahs,
will not be. You give it to
will be, it
CBI.
will be.
You
I
have
know
some
it.
to give it to CBI.
One more thing. The state must ensure that those who practiced acts of vandalism and
Absolutely.
Yes.
We have lodged
37.
37 already arrested, 50 FIRs filed. 37 already arrested.
50 FIR for one incident. It's a
clear.
recipe for not investigating.
you have one second. You have a copy of the, before we part with the matter for today, you have a copy of the autopsy report here?
Yes.
We have it. We have it.
I have.
We hand it over. Yes.
My lord, in the meantime, can I add
My
one
lord,
thing? my lord?
again request, my lord, if your lordships have seen something your lordships have, Lord, the CBI must be given, it will remain, my lord, confidential. But we must cross-check what is given to
Lord, your lordship-
This, the resistance shows that there is a lack of
No,
cooperation.
obviously there is a lack of faith.
Let me
Lord, your
do
lordship.
that on that day, Mr.
Only 1 second,
Yes,
my lord.
day after tomorrow.
Give
My lord,
the entire thing.
today, my lord, they can give me today. My joint director is here. I'll give it to her.
Oh, yeah. Allow it, yeah. Just allow. Yes. Yeah, yes. Now, my
What
lord,
is there to hide from
one
CBI,
sec-
my
one
lord?
second.
If they have given
Nothing is-
something related to crimes, it must be given, my lord, to the
Kindly
CBI.
kindly see page 40. Kindly,
Don't read it aloud, we'll just.
kindly page 40.
Right. शुरू करें पेट को बोलो काम शुरू करें
Yes, I know.
पेट को बोलो काम शुरू करें
Explain this. I'll just say, read.